1 month since becoming the nation's first coronavirus epicenter, Washington state has tracked nearly 5,000 cases and at least 195 deaths. But there's good news. It appears the spread of the virus is slowing. Hospitalizations down 20% last week. The governor says social distancing and the stay-at-home order issued March 23rd may be a factor.
We know what works. What works is to stay home. And there's no mystery about this.
The nation's top infectious disease expert says there are national indicators as well.
You're starting to see that the daily increases are not in that steep incline. They're starting to be able to possibly flatten out.
Nationwide, at least 265 million people in 32 states are under orders or advisories to stay home, though some have ignored the requests. New data from Kinsa Health, which makes internet-connected thermometers, shows the nation's fever hot zones. Fevers are a key symptom of COVID-19. The New York area and Florida are bright red. But look at this map showing fever trends over the last 7 days. The deep blue areas are seeing the biggest decrease in fever rates.
The data is showing that it's effective in every part of the country where we've seen social distancing actions implemented, shelter in place, stay at home.
It's my Gigi's birthday.
In San Luis Obispo, California, the Lombard family is self-isolating with a 2- and 4-year-old. Has it been tough to be in the house with 2 kids for 2 weeks?
There are times where the kids are, not getting along, and it is. It definitely is challenging. We will not spread our germs to our friends, our family, and we'll help flatten the curve.
Tonight, with roughly 80% of Americans being urged to stay home, health experts say it could take weeks or even months to truly flatten the curve.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.